Hi and welcome to this special gathering that we have here today. Um, the team that is here is actually my colleagues that I work with, and some of them have heard a little bit about female genital mutilation, and some of them have not had anything about this topic. I picked this topic because I think it's a topic that should be brought to the attention of women across the world so they can understand what's going on in the third world countries, particularly Africa, Middle East, and some countries in Asia. Just to give you the history about female genital mutilation, as I've actually put this slide up, this involves partial or total removal of the external female genitalia. This process is a pretty barbaric behavior that culturally my people in Africa believe that should be done to keep the girl's virginity, which doesn't really truly make sense, but that is their thought process. So hopefully it is something that we can work towards eradicating it completely, and a behavior that we can hopefully stop in the near future. So who are the best people actually who have talked about this and brought it to the limelight would be the WHO, the World Health Organization, and that's where I got most of my information from, apart from, of course, some of the background that I have experienced this behavior. As you can see, the estimate is about 100 to 140 million girls have gone through FGM. Right now, we believe that girls who go through this are between the ages of 8 and 15, and as young as maybe 4 or 5 years old. It's a process that actually the girls go through, and again, unfortunately, no sterilization, no anesthesia, it's done live. I don't want to get into too much detail because it can be really it can gross a lot of people out when you look at it, but I did put the procedure up there for everyone to read, and I will print this out for you so that you can go through it, just to have an idea of what it's all about. The other thing that I also wanted to bring to your attention is the health consequence of this behavior, and the health consequence is pretty gruesome if you look at it. It has no health benefits apart from harming the girls. Complications can be severe pain, shock, bleeding, and sometimes death. I've known people that have bled, but thank God were rescued by others and taken to the hospital to stop the bleeding. Some of the worst experiences that I've seen with people is increased risk of miscarriages, and sometimes stillborn birth, and losing the parent too during childbirth. So it's not a behavior that I care much about, but I try my best to educate people and inform people about this behavior so that we can do whatever we can to stop it. Who is at risk? Again, I mentioned about 100 to 140 million girls and women worldwide are living with the consequence of FGM. In Africa only, we're looking at 92 million girls within the age of 10. The common practice So if they find out, you're imprisoned, which is good, and I'd like to see that. Some of the causes of female genital mutilation include mixture of culture, tradition, religion. And with time, I honestly truly believe that this trend because this is the 21st century. Girls are growing up and saying, you know, we don't want this kind of behavior. I don't want to see my girls going through it. Hopefully, the women in my age group do not want to see that behavior with their girls, particularly the educated women. So hopefully with this kind of information, you're educated, you can go ahead and educate others about it. And the other interesting thing is it's a behavior that men tend to approve because they believe, you know, men tend to believe that they want to marry women who are virgins. And this is the only way to keep girls virgins, which is really untrue, because you can still have sex and cheat if you want to. There's nothing that can really stop you. So what is being done, and how can you help, and how can I help? I like talking about it, I like discussing it, I like bringing it to the attention of people, but I think one of the best organizations that you can get as much information and pass on that information is WHO, which is the World Health Organization, UNICEF, the United Nations Children Fund, that I actually even contribute to help kind of stop this behavior, and the United Nations Population Fund. And they're doing their best to try and make sure this behavior comes to a stop, hopefully in the next 10 to 15 years. So my hope is in my lifetime that we can bring this behavior to an end, and you know, the girls and women in all these countries can leave knowing that they don't have to go through this kind of mutilation. I don't think anybody wants to go through any kind of mutilation. So I hope this lecture was beneficial and we can pass it on. Thank you.